So now that we've seen the technique for marking an incision pattern for a WISE pattern or reduction approach, we're going to look at a video of a very commonly used incision pattern called a Donut Mastopexy or round block technique. And we'll also include a variation of this where there's an inferior extension of the incision. The round block technique is one that is able to access tumors in multiple locations within the breast. And you can make the incision pattern where there's preservation of the nipple position. You also can use this pattern to move the nipple to a more preferable location if that's a necessary part of the oncoplastic surgery. In this case, we're making the initial incision mark around the edge of the areola. That areolar size can be reduced, obviously, if that's part of the plan for the surgery. And there'll be a concentric incision that's made around the central portion. That's where the term donut came from, where you basically have an outer incision and an inner incision. The bridge of skin between the outer and inner incisions is where you'll de-epithelialize, and this is where shifting that incision either up or to the side allows you to either maintain nipple position or move it to a preferred location. There's also a variation on this where you can extend the incision inferiorly, and this is again another version of a skin reduction approach where instead of a full breast reduction, this would be referred to as a circumvertical incision pattern, where skin from inferiorly, in addition to the donut around the areola, is removed so that there is both tightening and lifting simultaneously of the external skin envelope. And obviously, if you think about where these incisions are placed, you can access any portion of the breast through this in a simpler pattern than you would for a full WISE pattern or reduction approach.